Hello. You're welcome to another episode of Unraveling the Knots, the podcast where we explore the rich, dynamic world of natural hair, identity, health, and all those in between moments that make us who we are. When most people think of public health, they picture hospitals, vaccines, or disease outbreaks. But public health is also about the daily choices and environments that shape our well-being. Even something as personal as hair care is connected to public health through product safety, salon hygiene, access to clean water, cultural practices, and even the environment. So today we're asking, where does hair meet public health? We'll uncover the overlooked links between beauty and health, explore risks that deserve more attention, and highlight ways to protect not just our style, but our communities too. I'm still your host, Ganiat Salami, project manager by day, beautypreneur and passionate solution provider for all things natural hair. I'm especially excited and intrigued about today's episode. And with me is a sister, my very good friend, Dr. Lynda Osadebe. Dr. Osadebe is an infectious disease epidemiologist, veterinarian, and public health consultant with over 17 years global experience. From CDC to WHO, she has led outbreak responses from mpox, Ebola, and other diseases across Africa, Asia, and the US, and now promotes health equity literacy and elderly care. A Yale PhD and passionate community advocate, she bridges science, policy, and everyday life. Hi, Dr. Lynda. Abby, Madam Lynda, as I call you. It is so good to have you here.
It's so good to be here, Ganiet. I'm so delighted to be in this space where our hair is being celebrated. I'm looking forward to unpacking hair within public health.
That's awesome. I'm happy to have you here. And you see, today's episode, I think it's going to be very, very enlightening. And I also can't wait to unpack so much with you.
Like I said, looking forward to the discussions.
Awesome. Okay, now. So before we dive in deeply, can you please introduce yourself to our listeners?
Thank you for that warm introduction, Ganiet. I've often been described as someone with no base.
What?
So at my sister's wedding, somebody asked me, where do you stay or where do you live? And her mother-in-law said, Beske, Ujumi. She calls me Ujumi. So Uju is my traditional name, and me. So combine my Uju. My Uju is like bird. It's like the bird of the air. And everything. There's no base at all. But, when you sit down and think about it, it's true. I grew up moving around every part of Nigeria, primary school in the east, secondary school in Ibadan, the south, you would say. And then veterinary medicine, I did it in the north, Hausa land. And it was in veterinary school that I was first introduced to public health and One Health. And everything, knowing that 70% of the infectious disease we have comes from animals. And that's where I heard about CDC, WHO. And interestingly, myself and my seatmate, he's late now, late ABG. We had this dream that we're all going to work at CDC and WHO. Moving 20 years later, I'm happy to say and kind of blessed that I have worked in both places. And it was bittersweet getting into CDC because I remember that conversation with ABG, and I had a good cry, and I dedicated my journey to him. I've worked with both organizations, responding to all sorts of outbreaks, mpox, Ebola, strengthening health systems in different parts of the world, Sierra Leone, DRC, the Philippines, beyond. During COVID though, my wings were kind of clipped, and I wanted to spend more time at home because then we really know what was happening in the world. And so I pivoted into the pharmaceutical industry, which showed me how science and business can work together. And I realized that, wow, pharma is human. And I met folks like you, Ghanaian.
Oh,
So
I know. We did work together.
yeah, we did, right?
Wonderful segue, honestly. Wow.
I know.
So yeah, like that's really wonderful. I just also wanted to continue with saying I want us to get personal here. So you've introduced yourself. You are Madam Mark Register around Nigeria. You also Mark Register within certain continents in the world. Okay now. So I just wanted to say, what has your hair journey been like from a young age until now? And how has your being a public health specialist actually influenced that journey?
Oh wow. Growing up, I must say I had very full, gorgeous hair. My mom invested so much in it. And like most African mothers, thank you, mommy. Because a child's hair is always a reflection of the family, right? So every Sunday she would thread my hair into different styles. I remember my hair catching up on door handles because of the different styles.
Ah,
And
hey, was it as serious?
yeah, I was thought, as in a short kid now and everything. So when you're walking through the doorways, you just, but the hair would just be held up.
Oh my God. How did you cope with those kind of incidences? What were like the preventative measures you took to avoid being dragged by the door?
Do you know what? I kind of expected it after some time. I kind of expected after some time, and I don't know. That is one of those things, or I moved away from the door or something. But it was, especially when she just finished doing it, right? And maybe I'm about to, or I'm running past something and the door just holds me back and all. But, those experiences that we remember, hair experiences. And then, later I started going to the neighborhood stylist, our Mama Iriti under the tree.
Within that small corner, very small corner shop.
That tiny corner, exactly. Every 2 weeks. Every 2 weeks. I remember there was this episode, I think was it your first or your second episode where you really delved into the experiences of Mama Iriti?
Oh my God. I mean, I didn't deal with a mama iriti, but I definitely deal with a mama.
Mama.
And I can never forget how will I say it? I can never forget like thinking about the experience. It felt very interesting because it was very vivid. You knew you were going to meet this woman. She was basically going to do your hair. She will put your head in between her legs. She will press your head. God bless you. Don't let your head stay still. Yeah, for me, making my hair was very painful with those hairstylists, those mamas. I didn't like it. But as you were saying,
yeah, I know. At the same time, there were kind of hopes to gather with friends, though. So it's something that I looked forward to, the playing with friends and all. And then, so going into secondary school, I was in boarding house. My perming journey started and everything, relaxing my hair every couple of weeks.
again,
I know, it felt glamorous and, the normal thing to do. Looking back, now I know those chemicals weren't always safe. and this thing. And then I moved to the US. With the relaxers here didn't suit my hair at all.
Hold on. Please explain how.
What's it called? They never did never did a great job.
By great job straightening your hair?
In terms of straightening the hair and everything. So it was still tough. I wasn't, and especially given the money that you spend, it didn't seem worth it. And at the same time, the salons refused to use outside products because of, liability and all that, which is understandable. So, I now decided that, I'm just going to revert to natural hair and no regrets, actually. And thankfully, because of my work in the past couple of years, I got to go to Africa quite often. So I was weaving and braiding in hair and connecting back with culture.
Wow.
Yeah.
So did your work also influence your decision for you to go natural? Or was it because of the logistics of your work that you decided to go natural?
That's a very good question. I think both.
Okay.
So logistics, access, cost.
Oh, yeah.
Yeah, all combined.
Wow. Okay. So, Madam Lynda, $1 million question. Are you ready?
Get girl.
It's like we're doing audio things this episode. We're making audio sounds. We'll see who does it best.
Best, right?
Thinking dun dun dun. Of course, you know how to bring mine now. So, is hair considered an important aspect of public health?
Great question. The short answer is yes. Hair is public health. And I would go over 3 main points how we think about hair and public health. Number one, hygiene and infections. When you think of lice, ringworms, right? And all this could lead to a public health response. And when you think of folliculitis, right? Then you think of the chemical exposure, the relaxers, the dyes, the synthetic braids, all have their own risk. And the third thing, which I'm glad that we're all talking about, is identity and equity. When you think of hair discrimination affecting mental health and dignity. So yes, hair is public health. And I think you'll be happy to know that even WHO agrees, and they kind of alluded to this, recognizing hair as public health.
Really?
Putting it as a priority. Yeah, they actually lumped it up with skin.
Okay.
But it's there, and they actually put out priorities for skin neglected tropical diseases. So it has its own focus. So that's a good thing.
Wow. So I will be very honest with you. I thought that hair wasn't even considered as something important in public health. So I hear you. You say it is part of public health. But based on your experience in your work, in interacting with your colleagues, do they actually consider it as public health? It's a different thing to say this is what the guidelines states. But in practicality, what's happening on the ground?
Fantastic question. And I would say it's not something that comes up in our discussion because we are always reactive in our public health, right? So it's more we're thinking disease outbreak, we're thinking control, preparedness, vaccines, right? And not necessarily the individual items, hair, skin, unless it's all tied to an outbreak or an infection, right? But it's a very, very good point that you bring up, and I think the thinking is changing, and especially when you now tie hair to the mental health. and all, thinking about, for example, the crown legislation and all that. So we are kind of catching up, but it's there. It's something we think about.
So I was going to ask you
Mm-hmm.
whether you feel like hair issues, hair diseases deserve more attention. What I'm getting from you is that it does. It is getting slightly more attention, but it does need further attention. Can you comment more?
Okay, so I would put it this way. Because in general, right, public health tends to be reactive, right? Even though now we are trying, so beyond like vaccines and all that, it tends to be reactive. So we really don't sit down and think of each element of the human. Things are changing now where we are now looking at, we have to look at every aspect, especially when you're thinking about equity and all that. In terms of infections per se, for example, the ringworm, right, lice, there are issues, especially for younger children. In fact, there's this data that says like 3 to 6 million children in the US, which it's something is hard to I can't believe it, but it's but it's
Million Kenny.
Can you imagine? I was like, that's
children.
I think that might be scratched out of here, but but anyways, so you have infections like that, and even in other countries, a quarter of the children between the ages young to like 11 years old, like a quarter of them have like scalp infections and everything. So ringworm and everything is pretty common, right? At the same time, you can easily treat these things, right? So it's not as if it's a life or death situation and everything. So maybe that's why it appears that, it's not an issue. The other part of it is when you're thinking of infection control. Our barbers, our barber shops, our saloons, the tools they use. And there've been studies that have come out, they've been linked with HIV, for example, and bloodborne diseases. So doing control over their practices, right? So when you're thinking about things like that, yes, it's definitely at the forefront of public health. And even if we think about COVID, why did we shut down the barber shops and the salons? They are all avenues for infection transmission.
Wow. I didn't think about it that way. But you know what point that you made that's actually, now it makes sense. When you said that kids have in the US about, did you say 3 to 6 million?
3 to 6. I got the data from the CDC, even though I'm still not comfortably opening my mouth. Because I think it's something. How many children do you know that, at least we have children in our lives that have come down with lice or something? I think we have pretty good hygiene practices that have taken care of those things and everything, and it's not an alarming. It's not such an alarm. However, you think about other populations, like for example, homeless.
Yes.
People in crowded environments, right? So, so it all these things all boil down to equity and being inclusive and making sure that we're including every single aspect into this conversation. It might mean that somebody needs to point public health to it, because public health will always deal with the majority. We can't think of like everybody, but that's why we have advocates that remind us that, these are a set of people that you should be thinking of.
Wow. No, I was even going to say that it makes sense that you would have about, I guess, millions of kids having lice and scalp issues, because, as you said, when people congregate, right, it's very easy to spread diseases. And look at kids, they don't got boundaries.
At all. You know them. They're little petri dishes.
Yes, like a daycare is, my goodness. It's a melting pot of all sorts of diseases. But coming back to our questions, I just wanted to say, so, Madam Linda, with your global experience, have you noticed differences in how communities treat health? Let's say in Nigeria versus the US. I'm just curious about whether culture, climate, or even public health systems change the way people approach health.
Great question. And I would say things have evolved with time. So in Nigeria, for example, majority health is often community driven, resourceful. Families might rely on traditional remedies and all advice from a neighbor, quick trip to the chemist, chemist down the streets and everything. Let me go and get one or two things, depending on what it is. Whether there's a headache or something, or even calling the doctor in the house and giving them quick symptoms, right? And it boils down to, access and cost. They play a lot. So people don't necessarily go and seek medical help unless it's really extreme, right? Or unless they are pushed to do it. So they become, creative with how they deal with their health issues. In the US, though, it's, there's more infrastructure for prevention, right? Annual checkups, screening, public health campaigns, and everything. Before the school opens, there are a couple of, health fairs that happen and all. And so maybe the diseases here tend to be more of lifestyle things, obesity and all. But on the other side too, even over the years, we've seen that even in Nigeria and other countries, we are beginning to deal with cardiovascular disease, high blood pressure. My dad was diagnosed with high blood pressure since when he was 25, right? Yes, and everything, and he's been on the medication till today. What happens in those societies, unfortunately, because infectious disease is so loud, and because they're dealing with things like malaria and all that, attention is being taken from those other chronic diseases. So that doesn't mean it doesn't exist. It's there. It's just trying, prioritizing. I think that's the word, and all, and even the cost of dealing with those diseases. Talking about climate, sure. When you think of winter versus versus our tropical weather, right, and everything, and you think of the whole malaria and vector-borne diseases. Another aspect, though, that I think things like COVID and Ebola brought is we in public health, the way we prioritize disease at some point, at a particular point. If you think of Ebola before we had the big epidemic in Sierra Leone, Guinea, and all, and the way it's expanded. Before, we always looked at Ebola that once you get it, 100% mortality. There's no, everything, the blood comes off from all the orifices and, you're done. Because of that outbreak, right, it affected people even outside the continent, especially healthcare workers that went into help, whether from America, from the US, from England. And we found out that maybe the mortality might actually be lower, a lot lower. Maybe 50 to 60%, but the catch there is the supportive care. It takes a lot of cost to be able to take care of Ebola and everything, which some of our countries can't afford, right? And everything, being able to deal with the infection control, able to do the monitoring, the constant monitoring and all that. So I think even the public health response and how we define things at a particular time affects the way we respond to diseases and how the diseases are being addressed in different climes.
Wow, that's truly fascinating. And I guess I wanted to even ask another question, something along the lines of your response, right? we did experience COVID not too long ago.
Mm-hmm.
And I'm curious, do you think communities are actually becoming more prevention minded, or are we still mostly reactive when it comes to health?
I think so. COVID introduced, hand washing, masks, vaccines, right? But we tend to slip back to the things we know, we humans, right? So the challenge is making prevention a daily life thing, part of our lifestyle, right? The way we're trying to do with nutrition and diet and everything, and not making it as crisis mode. Let me ask you this quick question. You went out today, right? Went for a walk or something, right?
Yeah.
How many, did you see anyone with mask on?
Today, no, but
No.
this week, definitely yes.
Definitely, yes. So there are a few people that still do it, and especially I think I'll give the elderly some kudos for this. It's been in church and all that, so you see them do it, going to the shops. But for the most part, I think we are just going back to being ourselves.
I mean, it makes sense though, because I guess there's no outbreak. But are you advocating for people wearing masks like more frequently than we used to pre-COVID, I guess?
I'm advocating for people to do what is safe for them.
Okay.
Yeah. So whatever makes you feel safe, and there shouldn't be any stigma attached or to that. So pre-COVID, I don't know that you ever noticed that anytime you see our Asian brothers or sisters, they always had their mask on, especially
Yeah.
at the airports and all that.
Yeah.
Where did that come from? Because in China, they had a lot of issues with what's it called, the quality of air, especially in certain times, right? And so they got used to that. It was kind of a lifestyle for them and everything. So just tying all these preventive measures to our culture, to us as human beings. At the end of the day, just do whatever makes you feel comfortable.
Okay, that's really helpful advice. I think I need to start wearing my mask again. I need to get my mask supply back. We can't be out here not, paying attention to health.
Anytime I, like, for the example, when I take a flight or something, I put on my mask
Okay.
and everything. So it's just depending on the close, quarter and all. And I know I'm a younger person, so hopefully I'm able to fight or whatever comes, right?
Yeah.
Compared to like the older people, compromised people. So I just think we should give everybody space to be themselves, however they want to appear.
Okay. Do you have any additional tips that you suggest as preventative measures other than wearing masks that you say works?
Oh, what's it called? I think our washing of hands never stops. And do you know what? I think our work policies. I don't think anybody that is sneezing and all that needs to be at work or needs to be in a pub. Stay home, please.
Yeah.
At the same time, I do understand because of the way as a capitalist corporate this thing, so you have to be at work. But seriously, if you're sneezing, sharing those generous germs, please be. Yeah.
Are germs ever generous though?
I don't know. Just stay home.
Okay.
And there's still those sorts of things, and things like that, and everything. And please, vaccines.
Yeah.
Whatever vaccines that, they are awesome. They prevent, they save a lot of heartache. So if you're eligible, please go ahead and take them.
Madam Lynda, thank you for dropping important health considerations. We appreciate. We appreciate.
No wahala, anytime.
But you know that we're a hair care podcast, so we're coming back to hair. So what would you say is missing in public health when it comes to hair care, especially from an infectious diseases standpoint? I know that you did flag that usually hair or scalp issues are not considered to be deadly. But still, what is missing? What is missing in the public health sphere when it comes to hair care?
Regulation.
Mm.
And it also ties to enforcement, right? So we talked a bit about safety practices in barber shops and in the salons, right? So it would be great. You know how restaurants have they rate restaurants A, B.
Mm-hmm.
You see, it'd be great to have that for our hair places, right? That's a good thing to have. It might be might be a long-term thing coming. Even dealing, because the way we look at hair product, even the FDA looks at it as cosmetics, right? And everything. So there's really no regulation behind it and everything, testing what is in. All this, there've been all sorts of carcinogens attached to them, even the synthetic braids. But no real testing has been going on. The onions is left on the consumer. No proper labeling. Right. So we need all these things to happen, transparency, and the manufacturers to be held more more liable and accountable for their products and everything. So it's regulation, enforcement of it, and even education. And for even we to know, how important hair is, healthy hair is, and what it means. The way we've started looking at our food labels, we should start looking at what we put on our hair, on our skin, everywhere. Maybe get away from synthetic braids, especially for our kids.
It's on the saying synthetic braids. What's happening? I mean, we've been hearing a lot of noise about synthetic braids. So what is the deal with that? And what are the implications, that people should be aware of when it comes to health?
They've been quite a number of studies, even more recent studies that have looked at these braids and have seen that they've been linked to, different health risks because of the chemicals that they have. So, for example, benzene, even lead. Lead has been linked with reproductive effects, brain and development and all that. And so they've seen all this really nasty and scary chemicals in them. And in fact, there was this study where they tested about 10, and 9 out of 10 of them had these carcinogens in them.
Do you know what products, like what brand products they were?
I can't bring it out from the top of my head, but it was done by a consumer. Is it consumer affairs or something? Yeah, it's actually on the internet. And they even tried to reach out to the manufacturers, and they said and they stood by the was the safety of their products and all that. So it's there. Actually, it all started off when a graduate student, I think, went to do her hair somewhere in New York. And a day or two, she realized that the hair was aching her badly with, bumps, like that kind of thing. And she took it out and, she decided, let me test these things. And that was really the origin of how all this was put together. Also, NIH actually has a study. It's called Sister Study.
Sister Study?
Yes, a Sister Study where they've looked at all the different products, synthetic braids, even relaxers, dyes, and all that. And they've linked these things with uterine cancer, even with fibroids. So it's out there. The research is trying to catch up. The question is, what's the next step? What do we do about it? And not necessarily what is the cumulative effect of these things. So it might not be, just using it once might not be a big deal. But if you use it all the time, and then think of our kids, the little girls that use attachments and now all that from when they're young till older. What does that mean? Right. So I think that's what the discussion is about.
Wow, that's truly interesting and scary at the same time. But I appreciate you flagging the importance of people reading the labels of their products. I think when it comes to diet, for me, I would say like I was big on that.
Mhm.
When it came to skincare, I was clueless. Hair care, I was clueless. And this was, I would say like, let me say like 7, 8 years ago.
Mhm.
But then I started paying attention slightly. And I remember during COVID was when I dabbled into actually making my stuff. And I started learning more about some ingredients, which, eventually brought me to this journey of creating my hair care brand. And for me, I'm very, 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 very committed to making products that are highly natural, that are safe, that are effective. And you know what's in the product. Every single thing is listed, including the natural essential oils, which is funny because essential oils too have become a controversy. They say some essential oils that contain an ingredient called myrcene, right? They said it causes cancer in the state of California. However, research is showing that it's actually like an anti-tumor agent. So, and I remember this because you have a lot of people that are into traditional, more like natural, homeopathic medicine. They love essential oils and they swear by the benefits of this. But I think it's so crucial to do your research because for us on our products, we even stated there, this is what the state of California says about my skin. So you as a consumer should be able to sit down, read, and make an educated guess about what you think is best for you. We cannot just be passive about what we're putting on our skin, especially even our hair, which is often seen as irrelevant, unfortunately.
I completely agree. I actually went for this health fair a couple of months ago, and there was this lady that had this app that she would point it at cosmetics, whether it's lipstick or whatever, and it will literally list all the ingredients and tell you what the health risks was. And I was just saying that imagine if we had that for hair products, being able to just point an app, you go to the salon or you go to a beauty shop and point the app and it's able to list all the things in it. So I think this is where AI can actually help us out in everything.
Oh, there are websites. I remember like EWG. You go there, you basically plug in the ingredients for a product, and it rates it for you, right? It tells you whether like some of the ingredients have some, how will I put it, like people, because this is the thing. Some ingredients are generally safe, but people are sensitive to it, right? So we also factor that in. I think that's why it's important to basically do your research, understand what some of these ingredients do a patch test, because, for example, even EWG says that an ingredient has some sensitivity, like people can be sensitive to it. You test it and make sure you're fine. And this is what I would say, like you have different ingredients, you have natural ingredients. I love natural ingredients. I cannot use coconut oil. It makes me itch. Like
it's the same thing with my sister. She breaks out.
You have you have to understand what your skin is sensitive or what your body is sensitive to, what you're allergic to. Because I feel like, yes, you have some ingredients that are absolutely toxic. You have some ingredients that are absolutely toxic, right? You have some ingredients that have been linked to cause all sorts of diseases. But even from a natural perspective, and I think it's important to be honest and transparent, some people are allergic to certain things. So just make sure you're aware of what you might be reacting to. Like you deserve to give yourself that much attention.
I totally agree. So listen to your body, listen to your skin, listen to your scalp. At the same time, though, I do understand if when people say this is just too much for me to be able to, I have to read every single thing and all. So I would say that the regulators, right, do the needful, do the most you can do, right? Make sure that, the things that we know that are toxic and blah, blah, are out. And so when people are not dealing with stuff, they know that they're dealing with, small, or when you think about it, it's at the smaller scale, even not having to be like a professor to be able to know what these ingredients are, right? And whether it's harm to me or not. Yeah.
Wow. Omo. Really deep dive, So, and I think you already talked about this, right?
Mm-hmm.
When it comes to hair products and ingredients, I was still going to ask, like, which categories or ingredients raise the biggest public health concerns?
So I do run away from categorizing things. So I'll put it more of this way. That is
I can make
more.
it a bit easier. Would you say like relaxers are called products that you would say raise a lot of public health concerns? Would you say dyes raise public health concerns? Which products would you say for hair care raise the biggest concerns?
This is how I'm going to put it to you. I would say that I wouldn't use synthetic grades.
Okay.
And I'm running around. I wouldn't use relaxers. and all these are known to have really huge health risks. But at the same time, it's not just the ingredients they have; it's the cumulative effect long run, right? In the long term, we really don't know about these things. So to be on the preventive side, you just have to know what you're putting on your skin or what you're putting on your hair, more like it, and everything. So I wouldn't rank them per se, but I would actually say, avoid them.
Okay. Okay. Noted.
Yeah.
Shama. Shama. Okay. So the nature of your job requires that you work across socio-economic lines.
Mhm.
Based on your experience, do you consider hair as a status symbol?
Everything is about context, right?
Yes.
So I would say in some climes, I would say yes. When you're thinking of, wigs, how luxurious it looks and all. But at the end of the day, right, I think hair is more of a culture thing. Actually, based on my travels and everything, it's more of a culture thing. Everyone wants their hair to be clean.
Mm-hmm.
Everyone wants to do, their different elaborate hairstyles, right? Whether it's weaving, whether it's whatever you define it to be. And I think that, when we are thinking, there was this question you asked about how, I can't remember exactly how you worded it, but, and it just made me think of who is defining what hair is, right? What is clean hair or what is luxurious hair, right? Are we trying to box hair like we box skin in terms of bleaching dark places? What you understand what I mean, right? Even in the refugee camps, you see people wash their hair and people, braid their hair to look good. Right. It's also a way of communication and community. I remember my younger sister used my hair to know how to braid. At night I'll be sleeping and I'll just feel, finger. So it's a lot of things. Yes, we've made it seem like, a couple of places made it seem like a status thing. But I think overall it's all about dignity and just being happy, showing up with whatever you define as your fine hair.
Yeah, I think the reason why I asked the question was because when I think of how our culture has evolved as Black people, as Nigerian people, as African American people, right?
Mm-hmm.
Maybe let me say more like the Nigerian American group.
Mm-hmm.
We can really take our hair seriously, but then we also considered the standard for our hair to be straight. We took relaxers. We would basically ensure that our hair is very Western looking. But now, these days, you have more people embracing the natural hair, which is a beautiful thing. But I guess when we think about, for example, natural hair products, there's this sense of, okay, this is the elite thing to do, right? As a Black person that is also informed, there's also that bouginess that comes from it. So that's why I wanted to ask you if if hair in this context is considered as a status symbol.
Well, you could say yes, right? And all, but I try personally, I do try to get away from thinking of it with that aspect, because I think at the end of the day, humans will always, for some reason, we humans always like to put things in beings, categorize ourselves. Rich, poor, elitist. No, do you understand what I'm educated, uneducated? And at the end of the day, it just mundles up things.
I agree.
So if you pick up in Nigeria, yes, there's some salons that won't even go in terms of going to do my hair, because even the cost, natural hair, even the cost. At the same time, in those communities, you also can go to the small regular salon and get your hair done, and it still looks great.
Yep.
And also at the end of the day, it's whatever makes people feel good. But the bottom line is let there be clean water so that people can wash their hair. However they want to do it. So I think that's where my discussion goes. Then let there be access to clean water so that people can wash their hair. And even when we're talking about products, we have so many natural products in our places. If you sit down and think about it, is it honey? Is it, do you understand? So let's all go back to those roots and celebrate those roots and everything, and not try to define it as these products that we see on the shelf.
Madam Lynda, thank you for those really helpful gems. And important reminders. Oh yeah, I'm Team Shea Butter. I'm Team Shea Butter. I love it. I put it in my products. I'm a Shea Butter bae. So I wanted to ask you another question. If you could shape the next 10 years of public health priorities, what would you put at the top of the list? I know it's not heck yeah. I know it's not heck yeah. You're saying?
So I think it will be more of, I think this, you might be frustrated with these answers, right? But it's just stronger preventive systems. I mean, we have to be more preventive focused than reactive. We've come a long way, but we still have ways to go. So that equity, and it ties to equity in access, whatever it is, clean water. Clean water, safe products, right? Vaccines, access to these things, access to basic health.
I have a quick question for you.
Yes, sure.
Are there any studies that have shown the benefits of having clean water versus not having clean water?
There are many in terms of so many things. Even when you just think of even the infections themselves, so cholera, typhoid, and all that, it's there. And there's this whole discipline of public health that is WASH. It's called the WASH, and it's all about providing safe, clean environments, which includes water, even sanitary environments, proper latrines and all that. So it's a huge part of public health. And some of us, I think most of us, are actually pushing that if you're able to provide clean water anywhere, you've solved most of the problems
of the world.
As in, when it comes to infectious disease, you've pretty much solved this thing. You think of most of the diseases that you listed, not the ones that cause like the huge outbreaks, but think about cholera, typhoid and all that. It's all tied to waterborne, all tied to food. And because of you don't have clean water, then the water that you use to prepare your food is bad, right?
Yeah.
And all that, even if you have things like boiling and all that. So if we can invest, governments at different places invest in clean water to the grassroots, things will, things will change. I'm looking forward to a time where anywhere I am in Nigeria, and I saw this in Cote d'Ivoire and the rest of them, I put on the tap and water comes out. Clean water should come out.
My goodness. It's the simple things, right?
It really is. It's just that we now try to complicate it, which really makes no sense.
Goodness. Yeah. Wow. This has been such an insightful conversation. And Madam Lynda, thank you so much for blessing us with so much knowledge today. So. And before we wrap up, I was going to ask, how can people listening reach out and connect more with you?
Oh, LinkedIn. So I'm very active on LinkedIn. So just search Lynda Osadebe and I'm there, right there. And I'm looking forward to connecting.
Awesome. And by the way, Madam Lynda is one of the nicest, sweetest persons that I know. That's why me and her I've been at Bombody for a minute now. I've not left her alone. She's so easygoing, such a pleasant and warm person. So yes, reach out to Madam Lynda. You will learn a lot from her.
I appreciate that. And it's this, it's the same way I feel about you. I just think you're an amazing, very smart woman. And I like the way you, bring up these topics. And there's really nothing like celebrating us, especially our hair.
You're making me blush. I'm really blushing. It's too much.
You know well.
Thank you.
Oh my goodness.
Wonderful. You see, this conversation shows us that hair care isn't just about beauty. Even though we know and see that, hair is also about health, dignity, and equity. Being intentional about how we care for ourselves, hair included, is part of overall health. Public health reminds us that everyday habits, even in beauty routines, can influence hygiene, prevent infections, and support well-being. When we make informed choices, we're not just investing in appearance, but in practices that protect our health and communities. Thank you, Dr. Lynda, for taking time to share so insightfully with us. I really, really appreciate it.
Oh, thank you for having me and even having this forum. And congratulations. I have been watching you all and you're doing amazing. So kudos to you and your team.
You sure I want to continue making me blush? Thank you. I appreciate the love.
Enjoy your flowers.
I'm so tolerant. Yes. So, if you're listening and this conversation impacted you, as usual, send it to your friends, sisters, or anyone who needs to hear it. You can always reach out to us at our email, utkinhair@gmail.com, and also on Instagram at UTK Podcast. We truly love hearing your thoughts. Remember, your hair is part of your whole self, so don't take it for granted. See you in the next episode.